Hello everyone, my name is Dr.Amin and I will be talking about disturbances in size of dentition. Okay, basically there are two types of defect in the size of dentition. Number one is microdontia and the other one is macrodontia. So in this video I'm just going to talk about microdontia, okay, and every detail I'm going to give you about it. So first we're going to talk about the definition of microdontia. What is microdontia? It simply means the teeth that are smaller in size. So micro means small and dontia, it means basically the teeth. So teeth that are smaller in size, they are called as micro. Now, there are three types of microdontia. We classify them. Okay, so the number one is called as true microdontia, true generalized microdontia. It basically means when all the teeth are smaller in size, the entire teeth, okay, whether we're talking about primary teeth or we're talking about permanent teeth. Okay, like in primary, there are total around 20 teeth, okay, normally, and in adult, okay, there are total 32 teeth normally, okay, 32 or 28. It depends on the presence of third molar. So every dentition, all the teeth in your oral cavity, if their size is small, they're called as true generalized microdontia. It's mostly seen in a disease called dwarfism. And what is dwarfism? It's basically a decrease in the growth hormone, okay, that leads to decrease in the size of the body, the muscle, the tissue, the bones, everything in your body. They have a size of reduced form, okay. The second type is relative generalized microdontia. It basically means that all the teeth are normal in size, but they appear smaller relatively due to enlarged jaw. It basically means that entire teeth in your oral cavity, they are of normal size, height, shape, width, everything is normal about them. But why they appear smaller is because the jaw, the maxilla and the mandible, they are basically enlarged in size. Okay, their size, in 3D, okay, dimension, they are relatively larger. So that's why the dentition, they also normally, they look smaller, okay. And we're going to talk about the third type, which is a localized microdontia. Now when one or few regional teeth, few adjacent teeth, okay, they're smaller in size, but the remaining teeth, they are normal, okay. So these are the three types of talk about. I'm going to show you some example, like you can see here that the entire teeth, they're smaller in size. There's also carious attack, and they're smaller in size. This is an example of generalized microdontia. And this is lateral incisor, okay. So you see how the lateral incisor, it's smaller in size, okay. You call it peg lateral, okay. This is now, what are the causes of microdontia? There are many diseases and syndrome, but the most common causes of microdontia is congenital hypopituitarism, ectodermal dysplasia, Down syndrome. It may be because of radiation, when radiation is being applied, okay, on the developing teeth, that restrain its ability to grow in size, okay. So that's why the dentition, they also sometimes become smaller in size, okay, because of radiation. It can also become smaller in size because of chemotherapy, and it may also be seen in cleft lip and palate, and also focal dermal hypoplasia, okay. Now the common teeth that are involved is lateral incisor, as in peg lateral, which I show you earlier. Third molar is also involved sometimes, and supernumerary teeth, okay. These are the most common teeth involved. Other dentition, they may be involved, okay, it depends on the. Now, what are the treatment options? Either we extract the teeth, okay, and after extraction we can place implants on it. In that socket we can place implant, or we can use dentures, we can build bridge, or sometimes we can keep the teeth, we don't extract the teeth, and we basically try to place a crown or veneer on it, okay, of a normal size, okay, or we can restore the shape using composite restoration.